Big data and analytics has a really important role to play in the NHS because it can deliver benefits to patients at the point of care. If we look at population health, even if we knew, if we could analyse data across the NHS, we can start to look at preventative care. We can start to look at areas where maybe a disease is prevalent or a certain condition is prevalent, and we can look at how we can prevent that in the future. And then prevent patients going into hospital, going to see their GPs. We can start to broadcast messages on different types of media so that people might know, that there is flu or there is measles or there is some kind of condition in your area. So, take precautions against it. You could also look at areas where maybe there is obesity problems, there might be problems with drugs, and start to target those areas and really start to put preventative measures in. So the data is there, the NHS is data rich, it's awash with data. What we've got to do is join it up so that we can analyse it. Well, the NHS did have a programme in place, it is still in place, called care.data, where they did intend to take the data out of the GP systems and anonymise it and gather it centrally and perform analysis on it. But this has hit some hurdles because the public don't, I believe, trust the NHS with their data yet. So the programme's actually been delayed by 6 months, so that I guess the NHS has got time to convince the public that their data is safe with them and they will not sell it on to third parties, they will not be able to link conditions to specific individuals. And once we go over that hurdle, I think we will start to see some real benefits. I always think when you go into an intensive care unit, you've got so much technology in there. But if you watch the clinician or the nurse, they'll go around and they'll individually look at each machine and they'll take recordings, they'll probably put it down in paper instead of linking all those machines together and getting a single view.